Thank you. Welcome. Welcome to our third episode of Breaking Myths, what you think you know about HIV and what might be wrong. I am Teresa Giles, your host, and today we have a special guest here with us. I'm going to let her introduce herself. Make sure you stay tuned. Tell everyone about this podcast. And if you're joining us live on TikTok, thank you. Join us. All right. So Jenna, hello.
Hi. Thanks for having me.
Tell them a little bit about yourself.
I'm a nurse practitioner. I've been a nurse practitioner for about 16, 17 years. Been with Hope and Help for about 6 of those years, just doing primary care, specialty care, whatever is needed in the community.
I love it. Now, let's get right into it because I know we only have 20, 25 minutes.
Sure.
Got a question for you. Can you get HIV from a toilet seat?
No, you cannot.
Can you get it from sharing a glass, a hug, or a mosquito? The fact that in 2026, so many of us still pause to think about the answers, it shows how powerful a myth can be. For decades, misinformation about HIV has been just as dangerous as the virus itself. This misinformation fuels stigma. It prevents people from getting tested, and it actively stops us from ending this epidemic. Now, this is HIV Real Talk with real solutions. And today, we're bringing you the facts. We are systematically dismantling the lies and replacing decades of fear with modern day science and compassion. That our goal today is talking with the medical expert that's on the front lines of this fight. That's Jenna, who just introduced herself. Jenna specializes in HIV. She is a nurse practitioner, and I want to say the best of the best. Thank you for being here, and tell us, how can we end this nonsense?
I think that is right. The important question now is that these myths are holding us back from taking a step from where we are, and we've come so far into what the next step is. And I think we really do need to set the record straight permanently.
All right, I want to start with the biggest, darkest shadow still hanging over us.
Oh, dear.
From the 80s. When many people hear those 3 letters, HIV, their minds immediately go to death sentence. What is it now in 2026, the medical reality of this?
Yeah, I think the medical reality is quite a miracle as far as we've come from then in 1981 to now. It is not a death sentence, and I want to be very clear about that. It is not a death sentence anymore. It's a chronic, manageable disease like any of the other chronic, manageable health conditions that we have. Today, with just 1 pill once a day for most people, or an injection every 2 months, is enough to get the virus so undetectable that you won't even be able to see it in your bloodstream. And like I tell all my patients, you are not going to die of HIV if you take your medicines. You're going to die of a cardiac disease like everyone else in this country. And so as long as you have the medicines and you're able to take them, that is all that you're going to need.
It's not a death sentence.
It's not a death sentence. HIV is not a death sentence. It's a chronic condition. And the only thing that should be terminal about it is the stigma that comes with it.
That's incredible. That's an incredible shift. So if people are living long, healthy lives, this must be a bust to that second myth. You can't tell if someone has HIV just by looking at them.
Yep.
Or, I'm sorry, you can tell by looking at someone that they have HIV. That's a myth.
It's a myth. It's straight from the 1980s. Things have changed so much since then. All we saw of people living with HIV was people dying of AIDS, right? And that was the sunk face, the really kind of fatigue look, the graying of the skin, the wasting away. And today, a person that's living with HIV doesn't look anything like that because of the beauty of medicine. They look healthy. They look like me and you. You just cannot tell anything about the way when you look at someone, you cannot tell anything.
I like that.
Yeah.
I like that. Now, let's go where the fear really lies. Let's go back to that toilet seat I mentioned. Let's talk about casual contact. Can you get HIV from hugging, kissing, or sharing a fork?
You cannot. No and no. It's an incredibly fragile virus, so it doesn't live on certain things. It does live on others. You can't transmit the virus through certain activities like just casual contact. You really do need a mucous membrane. So let me explain. On things like a toilet seat or a doorknob or a fork, these will not allow the virus to continue to reproduce. Specifically mosquitoes, we know that a lot of virus-borne diseases are carried by mosquitoes. It also is not that. It's also not airborne, so you can't catch it by a cough or a sneeze. We really need these different bodily fluids that are susceptible to the virus to be transferred from one person to the other. So that's why during sex, because the cells of those linings of where we have sex are more susceptible to either tearing or getting those seminal fluids that do hold the virus, that's why we see those areas as places of infection. So we're talking vaginal canal, anal canal, a little bit of breast milk, but the research is still going out on that as to seeing that we are seeing like a really big decline in the breast milk. So we'll stick with these ones that we know. But yeah, the mucous membrane in these places that we're having sex are the areas that are going to be the most susceptible.
So I want to make sure everyone heard you. You cannot get HIV from the toilet seat.
You cannot.
Listen, this is so important because the fear is what fuels my next myth. Only certain type of people get HIV.
Oh man, it's terrible and it's really dangerous because it perpetuates, like we've talked about, the stigma. It allows people to say, it's not my problem, I'm not at risk, I'm not gay, it's a gay disease, horrible stuff that people are still believing these days. I'm not a drug user, so there's no way I'm susceptible to it. It doesn't have a race. It doesn't have a socioeconomic status attached to it. It just doesn't. It's just a virus. And we are all susceptible to it if we are having sex, unprotected sex. And let's be honest, we're all having sex.
Yeah.
So if you're having sex, you are susceptible to it. I do not care what race, sexual orientation, age, gender, any of it.
Jenna, I hear you. But I also see that it affects some communities like African-American, brown communities, and gay men at a much higher rate. So how do we explain that without blaming?
Yeah, that's a great question. And I think it's critical. So I think, yes, it's true that the more sexual partners you have with higher risk sex are going to make you more susceptible to having the virus. But that's not the whole story. The massive part of this story is barriers to care or barriers to health. There's certain communities that are having an amount of stigma that is higher than other communities, right? We know this. There are systemic disparities within each community, lack of access to healthcare, lack of access to getting tested, lack of access to information. The virus becomes susceptible in those areas, but not because those people have done something to deserve it.
I like that. I want to move into a different area. We want to talk about U equals,
yes.
I've heard this. I want to shift that. And in my opinion, the single most important life-changing fact in this entire field, and yet so many people have never heard of it.
Yeah, and I would have said last week, most people know what it is, but I even got a call from a partner this week asking me, is that even true?
Yeah.
So I know that this is still a question out there. U equals U, undetectable means untransmittable. I remember when this happened, it was like we took a breath of fresh air that we didn't even know we were holding. Remember the day that they told us that the research had shown us this. So if you take your medicine every day, the virus will be killed in the bloodstream. While we can't get rid of it in the lymph nodes, it'll still be dead in the bloodstream. If it's dead in the bloodstream, then we cannot transmit it to anyone else. So not only is that where you want to be for your own self because it's going to do less harm, but it's also the best thing for the community because we cannot pass it to our partner. So if your partner is living with HIV, they're on their medications every day, they're taking it, and their labs say they're undetectable, it means we cannot see the virus in the bloodstream and they cannot transmit it to you.
Okay, I want to pause right there because what you just said, I want to make sure everyone heard that. I want everyone on TikTok and everyone on this podcast. You're not saying low risk. You're not saying unlikely. What are you saying?
Zero risk. Zero risk. Now, we also have PrEP, right? For people that have a partner living with HIV to protect you even more. But essentially, the science has told us that there is zero risk if your partner's undetectable of seroconverting into HIV.
See, this changes everything. This is also the perfect time to ask you the difference between HIV and AIDS. Can you clarify that for us?
Yeah, absolutely. AIDS is the virus that you get when you get infected. So HIV, that virus attacks your CD cells, which is part of your white blood cells that fight all your infections. So over time, if it's untreated, and it is transmittable. If it's untreated, then the HIV virus will continue to take over your white blood cells, will cause your immune system to be so low that it starts to not be able to fight off common infections that we get exposed to every day. So AIDS is the syndrome of where your body's immune system is so low it can't fight off infections. So it's the downstream of what happens when you don't treat your HIV with the medications. You can develop AIDS, acquired immunodeficiency syndrome, where you're more susceptible to getting sick.
One of our last podcasts, someone did write in and ask, can you have HIV and not AIDS?
Yeah, you can live with HIV for your entire life and never develop AIDS. In fact, everyone should live right now, even everyone who has access to medication right now should have HIV. Hopefully we find the cure in my lifetime.
Yes.
But yes, you should never, in this day and age, in this country where we have access to medications, should ever develop AIDS.
I like that. So Jenna, if the science is this clear, and I shouldn't say if, but it's this clear, it's not a death sentence, it's manageable condition, it's not transmittable by casual contact, and undetectable equals untransmittable, then why? I want to say, why are these myths so powerful? Why are they still having this conversation?
We're not fighting a virus all the time. We're fighting decades of stigma and lies that people have believed over the years. And what that has done is created fear, judgment, bias, prejudice against people. And I think the medicine has advanced far faster than our social community can advance and our social attitudes toward it. Stigma is massive, and it stops people from getting tested. It stops people from taking their medicine. They leave them in their car because they don't want their family to see it. It stops you from getting tested because you think, oh, I'm not one of those people that would ever be susceptible to that.
Exactly.
And that's really what we're fighting right now.
So the fear of the social consequences is now more dangerous than the medical ones.
Yeah, yes. Yeah, because and then if you don't know your status, then you don't think you're susceptible, you're not going to be protecting, and then who knows if you're transmitting it to someone else.
Oh, my goodness. Listen, for everyone listening, I want you to take just a second. How do we fight this stigma? What is the one thing you want them to do? Jenna, so everyone that's out there on our podcast, is on our TikTok, what do you want them to do?
I want you to get tested, number one, and make it normal. It should be normal for you and your partners to go get tested every 3 to 4 months. It should be normal if you're having a new sexual partner to have a conversation about the last time you got tested, and let's just go together. Hey, come to Hope and Help. You can get it the same day. Rapid testing in 15 minutes, you can get your answer and then go have fun, right? It should be something that we do like we get our cholesterol checked.
Right.
We should be testing. And the second thing is use your voice. Speak truth out there. If you hear anything going on, just don't assume someone else is going to educate someone. We need to be the people who say, you know what, that's actually not true, and this is how you can protect yourself, or this is the truth about that, so we can stop this stigma.
One of the things that we're working on is we're going to make it really simple on our website. We're building this myth versus facts.
Yeah.
But even if you don't go there, you can always call Jenna right here at Hope and Help. You can come see us at Hope and Help and find out, do you pass that quiz of the myth versus what are facts? I know we've gone pretty fast, and I want Jenna to say one last thing. If you had to say one clarion call or one call to action for everyone listening, what would you tell them?
Be kind to each other. I think know your status, get tested, know the facts, be educated, be part of ending the stigma. It's not just knowing your status, it's being kind towards anyone who we consider as the other.
Jenna, thank you. Thank you so much for bringing so much clarity and compassion to this conversation. This has been amazing and informative.
Thank you for having me.
I want everyone, please make sure you know your status. Just like Jenna said, ask the questions. And if you're thinking that there's a myth or you don't know if it's a myth or a fact, please ask us. Please contact us. Thank you. This has been HIV Real Talk with Real Solutions. I think we definitely brought that to you today. I want you to stay tuned because our next episode will be airing soon, and you want to make sure you understand. And remember, you equals you. Always remember that and remember what that means, okay? Thank you. See you next time.